going to review the chart for the order and find out what size of Foley catheter that they want. And usually they write a reason, urinary retention or something like that, so I have some clue what I'm working with. Then I am going to go into the patient's room. Knock, knock, knock. Hi, how are you today? Good. My name is Angela, and I'm a nursing student from Bainbridge College. And the doctor has ordered for you to have a little tube put into your bladder to drain the urine. Did he talk to you about that? He did? Good. Great. Well, first things I need to do is for you to tell me your name and your date of birth. Mary Smith. And 8/12/71. Exactly who I am looking for. Wonderful. Well, let me gather up my supplies and then we'll get started, okay? Great. Okay. And do you have any allergies, like specifically to latex or iodine? No? Okay. Great. Well, I'm going to go wash my hands and come back and we'll get started. So then I'm going to go, I like to go ahead and get my leg bag. I get my catheter kit, sterile gloves, my extra set, and then I have clean gloves for cleaning them up. Then I wash my hands. I come back into the room. I'm going to put on my clean gloves. Okay. Now, with the ladies, the one thing I can tell you, especially is if they don't have like a hip fracture or something like that, the wider you can open them up, the better. And if you can encourage them, like especially if they're not elderly, can you just relax your legs and your hip muscles for me so that their legs will just kind of fall down to the side, the better off that you are. Another thing I try to do sometimes is just put a sheet or something over them to kind of give them a little bit of privacy. It just makes them feel a little more private. And of course I've pulled the curtain. So, ma'am, first thing I'm going to do is just wash down here a little bit so we can make sure you're real clean, okay, before we insert this catheter tip. Okay, so now I'm going to I'm going to open her up as wide as I can, and I'm going to first go down the middle. Then I'm going to go to the opposite side. Then I'll go to the side closest to me. Okay? All right, great. I've gotten you all cleaned up. So let me just get the catheter kit opened up and we'll get started, okay? Now I'm going to go and wash my hands again. I'll move this out of my way. Get my covers folded back real well so that I have plenty of sterile filled area to work with. Holding my bag back, set me up my little trash can. This piece of paper is not important. Go underneath here, undo our little piece of tape. Now, if you're having to work with this, make sure you're grabbing this underside, okay, because that's the part that's not sterile anymore. And remember, we have our 1-inch margin. Now, I am going to go right here and touch just this top piece. Trying to touch just the corners, the least bit as possible. If it doesn't go down perfect, just drop it and leave it. Okay? Now, I'm going to take my sterile gloves. Done that. Probably always. Here's how it lays on. So much for this.
Here you go, right here.
Terrible. Gonna discard this. I'm going to rearrange my tray. I'm going to open my lubricating jelly. I'm going to open my swabs and put it right there. Then I'm going to take my catheter. And I'm blowing up my balloon to test it. Okay, everything seems to be appropriate. I'm going to let that deflate by itself. Okay, and I'm going to leave that attached. And at this time I am going to remove this blue stuff. Again, being very careful that I hold my tubing because it will flop right out of my hands. Okay. Now I'm going to take this right over here, my lubricating jelly, and lubricate it a bit. Then I'm going to put it back down into my container. Keeping our sterile fill. I am going to take my swabs. Now, when I go in to open her up, I want to open her up as wide as I possibly can. You get a one chance deal here. So I go in and I open her up real wide. Once that hand is there, it is there. It is no longer sterile. Okay, I'm going to take my first cotton tip applicator down the center. Take my second one on the outside. My third one. Okay. Now, I'm going to take my tubing. I am looking for the correct hole. I see where I'm going. If we are at clinicals doing this together, I will ask you, do you see where you are going? You can give me a nod. I'll be right there with you. Okay. We're going to start inserting. We are going to go 2 to 3 inches until we see urine. Once I see the urine, again, I am going to take this hand that's touching her and hold that tubing so it doesn't just slide right back out on me. Now going in here, it's hard to get in. On a person, it will just slide back out like oil on the floor or something. Okay, now I take this. I will insert all of the fluid. Once I have it all inserted, I keep my hand or my thumb on the plunger. I pull back just a little bit to make sure it's secure, and it is. So I can let go, and then I will come and disconnect this. At this point, the sterile component of this procedure is done. I now will change my gloves, just because I'm telling you, betadine will be everywhere, and I don't like to get it on stuff. And plus, I've been down there. So I take just my clean gloves. I will get my leg bag. My leg strap, I'm sorry. And I will make it, don't want it too tight, but we